Are you wondering what a dental implant case looks like start to finish? Do you wish you knew more about some behind the scenes as to how your dentist actually plans your implant case? Well, look no further. In this video, you're going to learn some behind the scenes on a somewhat complicated dental implant case. You'll see how I plan the case in the cone beam CT imagery and the final results. I'll take you through it. And at the end, you'll have a better idea what this process looks like. Let's get started. Our patient came to us because he didn't like the look of his front four teeth. They had worn severely from his bite and some grinding over the years, this tooth in particular. Now you can see we took an intraoral photo of this tooth, and there's just not a lot of tooth structure left. You can tell in the x-ray too, very thin structure there. We had a conversation about these other three teeth would be suitable for crowns. This one, there's probably not enough structure to predictably place a crown long term. So we went over some possible alternatives that included a dental bridge, a fixed bridge, but my patient preferred to replace his tooth with a dental implant. And so that's what we did. I'll take you through the planning next.
One of the first steps in planning an implant is taking a cone beam CT image. Now, cone beam CTs are really powerful. We can see 3 dimensions of the jawbone and the teeth. And for our case, we knew that we wanted to place an implant right where this tooth is right here. So I'll go to my implant tab, and you can see again, we've got our 3D image and also an image of all the teeth. And so it's pretty simple for me to just put an implant in approximately where I want it. And what I do is I'll adjust the angle and see where it lines up with the tooth root. Now in this particular case, this is a tooth we were extracting, and there was enough solid bone above the tooth that we were able to place an implant at the time we took the tooth out. That's called an immediate implant placement. And I use BioHorizons Tapered Pro implant for this case, and you can see it was a 3.8 by 15 millimeter implant. So that's kind of long, but it engages the bone, we say apical, to the edge of the tooth root. So that's the bone above the tooth root.
So after planning our implant, the next step was to take the tooth out and actually place the implant. And that's what we did. Where the tooth root used to be, you can see we placed our BioHorizons Tapered Pro implant. In this case, we did put a healing abutment on top. So the implant itself ends about right here, and the healing abutment screws into the implant internally. And in his mouth, this is what it looked like. You can see the larger hole where the tooth used to be, the healing cap above the implant, and in this case we did a small bone graft around the implant to fill the bone space between the implant and where the tooth used to be, and put a little collagen over the top. That's the pink part. Just one stitch was adequate for him, and it was time for him to heal. After a healing period of about 3 months, we were able to put on the final restorations. So you see these three teeth all got natural crowns, or normal crowns on them, traditional crowns, that is. And the implant tooth got an implant crown. And so you can see in the x-ray, I know my face is covering some of it, but there's the crown. And you can see where the abutment is screwed in, that little screw that screws in internally to the implant itself. Okay, now a couple things you'll notice about this implant and the crown. One, you might say, well, that gum level looks a little high. I agree with you. The nice thing about this case is we didn't have to manage it. I'll show you that in a second. So in the end, this is what our patient looked like before, right here, and this is what he looked like after. And you can see we really built up these teeth. We improved the color. He did some whitening on the back teeth. Elected not to do anything to mask some of the discoloration on the back teeth. But overall, he was thrilled with the result, and we are too. Now remember, I was talking about his gum line and why I wasn't too worried about it, and this is why. It's because when he smiles, you can't see up there at all. This is his full smile. And so he was thrilled because before the teeth were kind of broken down right here, right in the very front. And now there are these nice, beautiful, full teeth. By the way, you get bonus points if you notice that his teeth were all broken down and you were wondering, well, how were you managing the bite force relationship? And this is how. We actually did some orthodontics prior to us taking out his tooth or starting any of the crown work, just to create space between the bottom teeth and the top teeth. It's kind of hard to show you. There you go. Okay, so he did a round of orthodontics before we even started any of the restorative work. And that's the thing, with a dental implant or with any type of restoration, you can't just look at the individual tooth. You got to look at the smile and the bite as a complete system. And that's what we do really well as cosmetic dentists and as dentists who have an education on occlusion and bite force management. All right, so that was a relatively complicated implant case, and I could have gone into a lot more detail, but hopefully that gives you a better idea of what the process looks like and what your dentist is actually doing behind the scenes. I've got a lot more detail written on our website and my blog posts, etc. So check that to learn more and follow our page. I'll keep coming up with content.